Good morning, everybody. New South Wales recorded 14 cases overnight from nearly 20,000 tests, and 20,000 is a very good number for the weekend. So I really thank everybody for coming forward and getting tested. And on the Saturday, we had over 30,000 people who came forward. This is exactly what we need to do to stay on top of the virus. In particular, can we ask anybody with the mildest symptoms in those parts of the community where there are known clusters to come forward for testing? Our contact tracers have done an unbelievable job in making all the connections between people who've been impacted by the virus directly. But of course, there are still some unknown cases which are always a concern for us. Can I please remind everybody who manages an organisation or manages a non-government school or any other entity that large gatherings or mixing between organisations or routine schools is something which is not allowable under the COVID rules, and Dr. Chant will be talking to various organisations in the next few days to make sure that all organisations are aware of what is a COVID-safe way of moving forward. Can I also acknowledge, in addition to all the health workers and all the contact tracers who are working incredibly hard at the moment, all of our emergency services who are dealing with the torrential rain and the winds that we've experienced. I want to thank Commissioner York and her team from the SES for the work they've done. Since Friday evening, they've received over 1,600 call-outs in New South Wales, half of which are from the South Coast. Fortunately, only one family has had to be found emergency accommodation. Everybody else who's asked to be evacuated has either managed to find accommodation on their own, or else we're pleased to say that other communities which were on alert have now had that risk abated. We do know that those storm conditions will continue. We ask people to please be extra safe, especially when they're in and around rising floodwaters, and Commissioner York will provide a more detailed briefing. But I do want to stress, in relation to COVID, we are still in a state of very high alert. We are doing okay, we're holding the line, but we are at least halfway through a very critical phase, and it's really, really important for people to come forward and get tested, really important for people to be aware of where they've been and to assume that every time they leave the house that either themselves or the people they're coming in contact with have the virus. That is the only way we'll get through this, and we need to make sure people continue to do the right thing. But I'm grateful for the more than 50,000 people who came forward over the weekend to get tested. That is an amazing result for a weekend. And again, following Dr. Chant's advice and following what we've been saying, we ask people to curtail their activity. It's very difficult when people have attended a number of venues in one night for the contact tracers to do their work. We are in a state of high alert. We don't want to have to impose further restrictions on people's ability to be free, but we also do want people to be responsible and to listen to the health advice, because your actions can unintentionally cause enormous harm to so many others in the community. And I ask all of you to please consider your own actions and what you're doing, given the high state of alert that New South Wales is in.